All right, good morning, everybody. Welcome to the Cape Cod Technology Council's Coffee Q&A. We do these on the third Friday of every month. A conversation with a local tech star in our community. So today we're really excited to have Chief John Burke from the Sandwich Fire Department to join us. My name is Bert Jackson. I'm the CEO of the Cape Cod Technology Council and want to welcome you all here today. I would like to, first of all, thank our event sponsor today, Sterilis Solutions, for sponsoring us today. I know that we have got several folks on the call from Sterilis as part of that. I'm sure Chief Burke is going to be discussing more about the role of Sterilis and the work that he's been doing. So speaking of events and programs, last year in the fall, we had a coffee Q&A with Dr. Jane Ward around public health, some of the impacts of that. And that led us into our Indoor Air Quality Summit that we held in February. The Indoor Air Quality Summit was featuring Dr. Stephanie Taylor and as well as some folks from Onset Computer talking about the impact of managing your indoor air quality on virus transmission. And so today we're really excited to be following up on that with some new technology and processes that Chief Burke has been working on. And our moderator today is Dr. Jane Ward. So I'm going to turn it over to Jane and let her introduce the Chief. Jane?
Well, thanks very much. This is really exciting to me to be able to introduce Chief John Burke. I feel like he's probably a long lost brother of mine. He's been studying and teaching pandemic response for at least 10 years. That was his thesis when he got a master's degree in health emergency management, which dovetails very well with the EMT role and the prevention role that fire departments serve in our communities. He has been a real hero in my mind in terms of hands-on public health leader on the Cape throughout this pandemic. And I'm excited to hear him present his his lessons learned, hit the highlights of what happened this past year, and also mention this new exciting technology that allows another form of testing to ensure safe environments. So I'm not going to say any more. I have a few comments at the end of his talk, and then he has a 15 or 20-minute talk. We'll open it up for questions, and go ahead, Chief Burke. Thanks for this appearance.
Thank you, Dr. Ward. Good morning, everybody. It's a pleasure to be here. I did make a presentation 10 years ago to the Tech Council. I remember Bert from back then, and I'm happy to be back today. Like Jane said, I have about a 10 to 15 minute PowerPoint presentation just summarizing what we did technology-wise with the pandemic, and I'll talk about some lessons learned and the fact that this is not over. This will be a continuous thing. It's going to be part of our day-to-day operations moving forward, and then I'll be happy to entertain some questions when I'm done with the presentation. Special thanks to the folks at Thermo Fisher Scientific and Sterilis Solutions for partnering with us from the beginning to help us navigate and provide us with support and equipment. So we came out, on top when we talk about pandemic response. We felt very comfortable in the Sandwich. And before I jump into the actual slide deck, I think it's important to point out that the town of Sandwich itself, the town buildings were open from May 26th last year, all the way through the pandemic. They did not close to the public. There were a bunch of factors that I'm going to talk about that led to that opening being allowed. Part of it's testing, and part of it is some of the equipment you're going to see here. But I have high praise for the leadership in the town of Sandwich for supporting our cause and understanding the investments that needed to be made. And in the long run, it worked out very well for the community. So I'm going to share my screen. I'll make sure everybody can see this. And okay, can everybody see the screen?
Looks good, Chief.
Okay, excellent. So we're going to talk about a couple things today. The aerosol sense sampler from Thermo Fisher. I'm going to kind of go into the beta program, kind of the origins of that and how we were able to carry it through the actual peak of the pandemic and what we learned from it. And then I'll go into some other items when we talk about pandemic prevention. So back in October, our friends at Sterilis made me aware of a potential beta test program with Thermo Fisher Scientific on a air sampling device they were working on. So those discussions again started in October, and the technology and workflow looked very reasonable for a fire department to handle. And I think that was part of my initial concern, is how complicated is this going to be? Not one person can do this. And the workflow that was worked out and the size of the machine, as you'll see, was very, very doable for us. And once we got through that, and I saw some examples of the use, I felt very comfortable then bringing that forward to see if we could utilize that here at the firehouse. We ran the operation December to February. It operated 24/7, but on a 5-day week cycle, because we had to ship the cartridges to the West Coast. So we couldn't obviously ship on Saturdays or Sundays. So I'll go over kind of the process we used for that. We had a procedure all set for positive sample response. And one of the things that we had done leading up to this is, one of the reasons we're able to accept the beta is an aggressive testing program that we had actually started partnering with Sterilis back in April of 2020. So as you know, in March 2020 is when the pandemic started to hit. By the end of April, there were already some, testing devices that were out there, mainly antibody driven. The PCR testing was a little hard to come by. And we started our testing program April 27th of 2020. It was an antibody test program, and it was more to work through the testing process and get people comfortable with the testing process. And we knew that testing would be changing and pivoting as the summer led into the fall. And it worked out perfect for us because we had the process, all worked out ahead of time. So it was one of those things where we felt comfortable taking the beta test, the aerosol sense sampler, into the station because we had a robust testing program and we had buy-in already from our staff, which is important. This is what the machine looks like. Very portable. A good analogy would be a microwave oven in terms of type of size. So it can be picked up and moved around very easily. In the beta program, we would do, remain in place for what we call 30 sample runs during high volume COVID-19 numbers. And the beauty of this was in October 2020, when the discussion started, if all you remember, the numbers for COVID were down, especially here in the Commonwealth of Massachusetts, pretty significantly. But we had projections that there's gonna be an uptick. So the fact that we were able to work with Thermo Fisher Scientific on this and get it in place for peak use, and peak use again, December to February, was very advantageous for us and very important. So again, everybody worked aggressively to get it in place. The basically online reporting portal system, we had to get that set up. The logistics of shipping lab samples across the country 5 days a week, workflow, PPE, making sure that we were using good hygienic practices when we were extracting the cartridge. All that we were able to work out in that 6 to 8 week period leading up to December 1st. So again, we were able to hit the ground running pretty quickly. The beauty of the UPS drop box program is the UPS drop area was across the street from the fire station. So that made it very easy as part of the workflow and shipping to be able to do that. The sampler utilizes a proprietary cartridge. We would change out every 24 hours and it would be logged. And we would start on Sunday, and last sample was sent in on Thursday afternoon. It was analyzed through a PCR testing analysis through Atlas Genomics, which is a laboratory out in Seattle that Sterile Solutions had hooked us up with. And then the notifications and results were made through the testing portal. Now, a couple things when we were looking at workflow is, okay, we're pulling the sample, say on Wednesday, we're sending it out. We're probably not going to get notification of a positive or negative for about 48 hours. So we had to be pretty basically tight with who was in the building for contact tracing. So if we did get a positive, we could exercise the testing platform pretty quickly. So that was one of the things that we knew going in. There would be a lag in the actual results. So we had to have that 48-hour box of tracking people that were coming in and out of the station. But knowing that ahead of time made it fairly easy for us to be able to utilize that. Again, the sampler itself, it's a regular plug, plugs in. We use the hallway here at the main fire station. We have a first aid testing room, and we put it directly across from that. And it's also kind of the main hallway for people coming in and out of the building. So it was a high volume traffic area for both municipal employees and then vendors that were coming in and out of the building. And again, we were targeting that December 1st to February 1st peak projected time for COVID. And if you've been following the numbers, January 6th was the highest recorded, I believe, national number, and here in the Commonwealth, it was roughly 7,000 positive cases. Now, there were 88 yesterday, so that shows you the difference. But again, having it in place in that time period was important. The other good thing about the lead-in time from that October to December implementation was discussion with the employees, right? I had two unions that we're dealing with here, the firefighters union and the secretarial union, about use of the machine. And the concerns was, how would data be utilized, and who would be the reporting person for that, who'd be the gateway, the gatekeeper for that information. So we worked that out with the unions ahead of time, and they realized, I think, going in, that this was a positive thing. Remember, we were transporting at the time, we get into the December, January timeframe, 8 to 9 patients a day COVID positive, the Sandwich Fire Department was transporting. So these workers and employees here were around COVID 8, 9, 10 times a day. That's just transporting patients. And then you're in the hospital, you're in nursing homes. And then the thought was, am I bringing this home to my family? So, and again, if you are positive or you're exposed or considered a close contact, you're looking at a 10 to 14 day being out of commission. So having the device here was a nice additional add-on, I think, for the employees to know. And it also provided me with the ability to make sure that the mandated masking policy here at the station was adhered to, because we had this machine that was running in the background. So the results of the 30 sample run were 28 negative runs. The interesting part was we had 2 positive hits on December 30th and on New Year's Day. And looking, we initiated the contact tracing and testing protocol. We were notified of the December 30 and January 1st hits. Now, I will say the drawback was we didn't get notified until around January 4th because of the holiday and the way the holiday fell and transporting samples. But we had an employee who on that same day on January 4th was symptomatic and exhibiting symptoms. And our policy here was, you stay in your car, we will rapid antigen test you in your vehicle, which again, Sterilus helped us out with securing testing kits. And then if you were positive, obviously you had already been isolated. We started contact tracing. If not, you would come in the building. Well, this individual tested positive in the parking lot on January 4th. We immediately implemented contact tracing, and they stated they had worked December 30th and January 1st. The other firefighters that were working, and the way we do our work schedule here is you do a 24-hour shift, you get a 24-hour period off, you come back for another 24 hours, and you have 5 days off. The group that was working worked December 30th and January 1st. So we were able to basically get those employees rapidly tested on January 4th. And then, as you'll see, we did a subsequent follow-up testing, both PCR and rapid antigen, to rule out any of them as being positive. The employee in question admitted they did not wear a mask while working. Because of the holiday, because the administrative offices here were, most people were on vacation, they felt the exposure risk was minimal, and they did not wear the mask, which again, everything kind of matched up. So when the dates were identified, the same working group had worked both days. All staff that were in the building at that time frame were rapid antigen tested, and they were tested daily for 7 days. They were also PCR tested on day 5 and 7. All employees working those 2 shifts were negative, with the exception of the positive employee. And again, we confirmed the positive employee on the 6th of January with a positive nasal PCR test. Again, the employee stated they didn't have the mask on for the majority of the time. They were working in and around the machine in the first aid room, doing cleaning and other stuff. So they were in the vicinity of the machine without their mask. And they did say December 30th and January 1st that they felt off, but there was no fever, no significant symptomology, just they felt a little bit off, and the symptoms really accelerated on the 3rd of January. And when they showed up here on the 4th, there was loss of taste and smell and a fever, which again was confirmed with the rapid antigen and the nasal PCR test. One of the other things we did was, what do we do with all of our waste remediation from our COVID testing? That was a question that the firefighters had. We're doing these rapid antigen tests. What are we doing with that waste? Is it sitting around? We've been working with Sterilis for many years. We have their waste remediator here for the last 6 years. We were able to rapidly remediate any testing equipment or air cartridge pieces, basically point of care, and we were able to do it immediately. It steam sterilizes the materials, and we were able to take care of the waste. So we were able to, from cradle to grave, both with the aerosol sense machine, with the Sterilis machine, and with our testing supplies, have a well-rounded, aggressive approach to COVID-19, both testing, surveillance, and remediation. We're able to do everything at once. And we partnered with, again, Sterilis and a bunch of companies with public-private partnership that was really impressive and led to a great outcome. We were so pleased with the beta, tests that we did and how it worked. And I should mention also that the machine was moved around. On January the 8th, we did public safety vaccinations for the entire Upper Cape region, approximately 400 to 500 first responders. We were able to take the thermo scientific machine to our vaccination site and run it for that period of time. The interesting part is mask compliance was 100% at the vaccination site. And we did have 5 people that ended up being COVID positive that actually came through to get a vaccine that the machine did not pick up on, which I look at as a positive because of the mask compliance and measures that we had put in place. All the personnel that were working at the vaccination site were PCR and antigen tested subsequently after those positives. They all came back negative. So it kind of showed that the machine was doing its thing. We had the aggressive measures of mask wearing and the hygiene procedures for the vaccination clinic, and everything turned out in the positive. What we're doing with the machine now is we're doing passive surveillance. And I think one of the mistakes made last year is people got very lax over the summer. And we actually ramped things up here with aggressive purchasing of supplies and setting up for what our testing protocols and flu vaccines would look like. So right now we're going to run some passive surveillance with the machine this summer. And then the plan is to ramp up to daily testing through those peak periods. We consider November to February. We'll see how that goes, but we will move it around. And the hotspot location. So one of the things that is good about the machine is like voting, right? So the elections this past year were, one of the largest attended voting elections in recent history. Having a machine like this at one of our primary polling areas, you have built-in contact tracing when you have voting because they are checking in. So our plan is to run it for the fall elections, which are on a smaller scale here in the Commonwealth and locally. We are going to run the aerosol sense sampler at our voting precinct to see if we get any hits. And again, it's a tool. It's not a primary tool. It's one of the tools in our toolbox that we're going to utilize. But I think our election staff felt very comfortable knowing that this would be in the background. And the majority of our election staff are retired folks that are in the high priority category. for COVID-19 exposure. And so looking at that and planning for that, that's our plan, I think, moving forward, and having the flexibility of moving the machine around, I think is going to be important. In summary, great joint public-private partnership. If you know anything about government, the government promotes public-private partnerships, especially in public safety and emergency management, but half the time it's not accomplished. This was a great example of Thermo Fisher Scientific and Sterilis working with us to lead to these very positive outcomes. And the machine, the aerosol sense machine, led to better mask compliance. I think more importantly, a level of comfort with our first responder personnel working during the peak periods, that there was something in the background also that was backing them up. And again, it wasn't I think part of their concerns were not necessarily the firefighters themselves. It was the station that we're in was newly constructed. So there were still punch list items and vendors coming in that had to come in. And I think that was their concern, is that we had this machine as kind of in the backdrop. And when people would come in, the vendors, they'd be like, what is that thing? And we would explain, and you could see that if their mask was just below their nose, it kind of slid up over their nose at that point. They knew we were taking it very seriously, and the masking protocols that we had in place here at the station. So it was just a good backstop for us all the way through. And again, that's what led to the purchase of it for future use. And I think there's a flexibility there with the machine, and Thermo Fisher Scientific can certainly speak to it more. But what's the next pandemic going to be? Or is it available for flu monitoring, stuff like that? I think having a multi-mission machine, that we can get in on the ground floor and get our people used to using. I think there's a possibility there down the road that there's some flexibility for other uses. So we wanted to be, at the tip of the spear, as they say, moving forward with this. All right, let me stop screen share. So I told you it was fairly brief. Couple things, lessons learned from the pandemic that we learned here in Sandwich. I was lucky enough to do my grad school at Boston University in pandemic planning. Spent some time working with the Indian Health Service. I did some H1 and N1 work out at a Native American residence in Washington State. We were lucky here in Sandwich that our public health nurse and town health director and I had all worked together since 2008 on drive-through flu clinics. And we were able to pivot pretty easily to the COVID-19 response, at least on the drive-through and distribution piece. And then I was able to take about 30% of my graduate work and thesis work and implement right away. And I think some of the things that we did right away was communications, texting group, leveraging Zoom and Adobe Connect technology. In February of 2020, the IT staff in the town of Sandwich started the remote work program with LogMeIn. So we were training town staff to be able to work remotely in February, with a projection that this could escalate in March and April. Weekly PSAs with the health director and I that you can still watch on YouTube. We did about 70 of them over the last 15 months that kept the public informed as not only what the numbers look like, but what we were doing. So if you have that communication piece, I think that's important. And then the testing. And it's more about the process than the test itself. And I faced some criticism last fall when we were doing antibody testing of our public school teachers re-entering school in August. And I was trying to convey to people that, the test would give us a read on whether they had COVID in the past. But what it gave us was the ability to be one-on-one with every educator before the school year started, to sit down and reaffirm mask wearing and hygiene and answer questions on COVID and get them used to the testing process. And we were able to do that. And through the school year, we did a significant round of testing. The Sandwich educators, some were tested 20 times for COVID. We were able to quickly find some mini outbreaks and isolate the teaching staff quickly. The Sterilis folks were able to retrofit one of our ambulances into a mobile testing unit, which we were able to go building to building and rapidly test our educators and our municipal employees to keep the operation moving forward. And I think my priority with all this was continuity of operations, keeping the town open, obviously keeping my department functional. And I think having all these tools, especially the thermal fisher machine, I think really helped our employees, feel comfortable coming to work. And when you put all of that together, when you look at the aggressive testing, the communication platform, the ability to extract 30% of my thesis work to get us basically off the ground, I think we had a head start early on. And one of the things that, and Dr. Ward and I have had this discussion, but if you have a 60% solution, you cannot be afraid to execute that. And I think elected leaders a lot of times look for the 100%, and you have to have the ability to go out there and say this 60% solution is good for now. It's probably going to escalate to a better solution, but you have to be able to show that you're aggressive in doing that. As long as there's no harm and you're able to move the needle forward, I think that was our strategy from the beginning. And again, having town employees and municipal employees, 500 municipal employees comfortable coming to work in the town of Sandwich, especially in the peak of the pandemic, when a lot of communities still aren't even open yet and they're doing online and remote hours. I think having that was extremely helpful. And I'm very proud of the work that the town did. Very appreciative again of the private sector support that we had. And this is not over, and it's going to pop up here and there. It's going to be pretty much a permanent part of our response matrix here at the fire department. And at one point, we had actually taken a paramedic and detailed him to work for the town nurse for 8 weeks to assist with testing and vaccines and all that. So that's the type of thing that lessons learned. You learn that you may have to adjust may have to think outside the box, detail a paramedic for 8 weeks to work with the town nurse. The other thing we did is our library was under renovations. We extracted our library staff to be a call center folks for residents in the community. And it did two things. It decompressed calls to public safety. It allowed people to speak with town employees that they knew from the library. And naturally, the library staff is good at public relations. And that was a huge win for us to decompress those phone calls that normally other towns were getting. We were able to route through our call center at the Council on Aging that was staffed by these library folks. And for 10 to 12 weeks, they handled a lot of the questions that were coming in from the community, which made our job easier. So that's the 25-cent summary. I hope I didn't talk too fast, but I want to give the ability for questions and to have a further discussion. So Dr. Ward.
Chief, thanks. This is just so over the top, the best example, best in class example of how to manage a pandemic. And I just want to, I had a few slides, but I think rather than take up time from questions, I just want to highlight a few of my impressions. I trained at the Military Medical School, the Uniformed Services University. Chief actually teaches there. He teaches in the disaster response course every year in the occupational and emergency medicine section. And what I want to emphasize, and what he's emphasized, is this approach is teachable. This is a method, there's a science to it. And in order to be able to respond appropriately as a community or as a country, we need more people who have this training. One of the crises bits of information that has been shown is that we have scooped out our public health infrastructure, public health to include our first responder groups such as fire, police, and EMTs. We have lost approximately 60,000 public health professional positions in the last 5 or 10 years. Those are people who have the type of training that the chief has that could lead communities through in this very methodical step-by-step approach. The other thing I want to point out that really jumps out at me, I'm a physician. I worked in a tertiary care center. This is a public health approach. This is a public health, population health approach, which means your focus priority is keeping your people healthy, keeping the healthy people healthy, and particularly keeping your providers healthy, or your EMTs or your firemen healthy, so that they can take care of other people. This is not the 100% proven drug that's been through years of testing. This is the 60% solution. It's like the battlefield solution. You move forward on the best information you have at the time to protect the most people, to do the greatest good for the greatest number of people. He emphasized several principles. One we call in public health and environmental health the precautionary principle, which is basically what he has been saying, what I just said. You don't wait for 100% proven evidence. You operate with the best evidence you have to protect public health. In Europe, that means they don't let chemicals out in their industrial system until it's been proven to not cause a disease, rather than we let things go and then we wait for the evidence that there has been a disease. Communication is probably front and center, the number one thing. You need to have communication that's accurate, that's updated, and that comes from a trusted source. The library partnership was fantastic. And people could call the library, talk to a librarian or a staff person they knew, and at least get the advice on where to go for different testing, or what was the current thinking. That was critical, and that was throughout this. The other thing that this wonderful instrument has allowed them to do is something that is part of a CDC recommendation, but I feel like has been the Cinderella stepsister of the CDC this whole pandemic. There's actually a national institute embedded in the CDC called the National Institute of Occupational Safety and Health. Their principle is embodied in one image, which I can share in the recorded version, and it's called the hierarchy of controls. You protect individuals with personal protective equipment, but you do a better job if you can protect their environment. Keep the workplace safe, which is what the chief has done in spades, and particularly with being able to monitor it with this fantastic technology. You make it so that people are not scared to come to work because they know their workplace is maybe the safest place in the community. That should be the case for our hospitals, our fire stations, but also our grocery stores and our travel locations where people catch public transit, and within public transit and within ambulances. Those environments should be able to be tested and to be kept safe during a pandemic. And then just finally, and I'm sorry to run on and open this up to questions next, this is not over. And it's great that we've turned a corner and we're in a good place within this pandemic, but meanwhile, the variants are multiplying around the world and people are continuing to travel. This is not over. And to partner this with the flu vaccine program in the fall, I think is fantastic. And the chief has explained very well how you train your population, you educate them, you train them, you reassure them with the process of coming to key places to get tested, to get information, and then to get vaccinated or to wear their mask as needed going forward. So I just can't say enough good things about what you all have done this last year and a half. And the partnering is important, but this is trainable. We need more people to get this training. You don't have to get a master's degree, but you could get a 3-day workshop. So we need to be thinking about that. And since I've been talking so much, I haven't paid attention to questions. Robin, I don't know if you can help me if you've been monitoring questions, but let's open it up for questions for the chief. And thanks again. This was terrific.
Yes, good morning. So yeah, we're open for questions now. If anyone has questions, please drop them into the chat. Chief, maybe you could talk a little bit about how you feel this technology would translate to residential homes. So what should people be doing at home?
Yeah, so I think at a minimum, airflow is important, and turning over airflow. So part of the reason numbers were down in the summertime last year is because everybody had have their windows open and you're introducing more fresh air into the environment. So at a minimum, that can be done. I think looking at air conditioners and making sure those are serviced and cleaned believe it or not, is an important factor. This machine itself for residential use, if you have a lot of money, I think it's possible. I think with any technology, this is going to, eventually make its way. I think it's more important to emphasize use, like Dr. Ward said, in our high throughput commercial spaces and public spaces first. And I think, if we can emphasize and get people to think about the occupational environment and keeping it safe with instruments like this, just gives people that assurance when they go in to pay their taxes. Let's say some people don't like to pay their taxes, but let's say they have to go into town hall for something that, they'll see the machine and then they see it in another building in town. And it gets to be, a quick analogy is automated external defibrillators were few and far between 20 years ago. You see them everywhere in public buildings now on the wall, and people are used to it and they get comfortable with it. And I think that's a direction that this is going to go in as we move forward.
What percentage of buildings in the town of Sandwich are using this now?
So it's just our building to start. But the beauty of it is the portability that we can move around. So just to give you an example, the month of June in the tax collector's office is the busiest throughput of citizens in the town of Sandwich. The machine will go and sit at the town tax collector's office for the month of June, just to monitor because of the amount of people. The fire department has, we're mainly vaccinated here. 95% of my employees are vaccinated. So we have the flexibility to move the machine around a little bit. And once we get more comfortable with it, then you buy another one, and you put it in these high throughput municipal buildings. And again, having the capability to monitor. And then it's all well and good until you get a positive. And this is part of the problem. If you don't work out ahead of time what your plan is for a positive hit and what structured steps you're going to take, it's a waste because you're playing catch up from the beginning. But if you know with an aggressive testing platform, if we get a positive through contact tracing, these are the steps we're going to take, and people know what those steps are that work in those buildings, then I think you have a seamless transition for placement of these devices in these municipal buildings.
If I could just add to that, I think that's a really key point. You shouldn't test for anything, whether it's COVID or whether you're getting a diabetes screen or a glaucoma test, unless that person can be notified quickly or appropriately and has somewhere to go for follow-up. So here's where partnering between the public health side and the fire department and the first responders and the hospitals and the clinics is important, because not everybody who's a positive COVID patient was hooked into the healthcare system. So there's this huge, there are public-private partnerships on a lot of levels, but our medical system is not public. It's not like it was for me in the military. It's everybody's got to work out their own system, and we have fantastic clinicians and hospitals available, but it's not easy to connect to those. And personally, we found it very difficult to get through the telephone triage line during the early pandemic when we had concerns in our household. So to hear about your people that are able to give information through the library system is wonderful. And to have it available by phone for people who aren't tech savvy, who can't get through on their computer or the internet to get a question answered, is terrific. So, I see a tremendous opening for regional education and partnering on this between the schools and the first responders, the fire departments, and the hospitals for future planning. The other thing I want to point out is that this was an airborne virus that was not really emphasized as an airborne virus by many of our official groups, namely CDC and WHO, until really fairly recently. But a tremendous number of other viruses and problem actors are airborne: mold, flu, many other diseases, Legionnaire's disease, TB, measles, some of these things that are making a comeback because people haven't gotten regular immunizations, but just mold. If you put in clean air technology into whatever building you have, your home or your business or your community building, you're going to have less illness from any of those airborne entities. And Chief, is this particular unit going to be able to test for more than just COVID, or does it already?
So I'm not really at liberty to speak to what the future holds for the machine. I think it's looking at, I would assume it's looking at that flexibility to be able to test for multiple things, because it provides that intrinsic value long term. I make an investment in a machine like this as a municipality, and let's just say COVID falls by the wayside. What's my other uses for it? That it's the financial justification for purchasing it. I think there's going to be future flexibility with what this can test for, I think, moving forward.
Chief, can I ask, have you had an opportunity to collaborate on this with any of the fire chiefs in the other towns on the Cape, and where are they in this process?
So yes, the short answer is yes. I think lack of knowledge of the virus and public health measures is a weakness in public safety. I just happened to fall into a master's degree program where I happened to pick pandemic. So they leaned on me pretty heavily throughout this. I think their thing is they wanted to see how this played out with us. And somebody's got to be the first one to do it and cut their teeth on this. And I think there were union issues that they were concerned about. We were able to flush those out pretty easily. And I think they're looking at now, what is their posture going to be for the fall and winter? And it's all about workforce readiness. This is the other thing. I had to pull out a doomsday plan for staffing that I never thought I would pull out. And at one point, we were 33% of our employees were quarantined or COVID positive. So again, looking at with the fire chiefs, anything you can do to prevent and identify quickly, I think is important. And the other thing I'll add, and Jane alluded to this a little bit, our folks at Sterilis hooked us up with Atlas Genomics. We had a private lab doing our PCR testing. We identified that as a critical objective in July of last year, knowing that the system most likely would be overwhelmed. PCR results were taking 5 to 7 to 14 days. If you're a first responder and you're out for that significant period of time awaiting a PCR result, that does not help the operation. The fact that we contracted with a private lab and were able to get results within 48 hours of our employees, again, kept our operation functional. And I think these are the lessons learned that chiefs are now picking up on is, you have to be flexible with testing, with occupational medicine of your employees, with devices like the Thermo Fisher Scientific machine. And I think they saw the value for the town of Sandwich. And I think a lot of them are now trending in that direction to say, this is what we need to do moving forward, to keep our operation running.
Okay, but at this time, none of them have invested in the equipment?
Nope, they have not.
Okay.
And I would say, I think the whole protocol and the thought process of your response is the most important thing. I think this technology is fantastic, but I think that the method, the communication with the public, the support by your elected officials and your town management, all of that is critical. And you respond best in a crisis if you've prepared for this ahead of time. The whole time we were in the military, 26 years and more, including school, we always had the mindset is that you prepare for the worst and you hope for the best. And the reason you hope for the best is you do a lot of practice and planning and tabletop exercising. And I think in quite a bit of the teaching you do, Chief, you help groups through that exercising process, which can point out some things that you might need to rectify in advance of the crisis. One of the things that I've been, maybe I'm living under a basket or something, but I haven't been aware of very easily accessed information like an emergency operations center output Cape-wide during the last year and a half. And it's not been on the public radio or whatever, though maybe I'm just not accessing the right places. But I would think that going forward, whether it's the pandemic or a hurricane or the flu or whatever, that maybe that could be worked on in some regard. And I wonder what comments you have in terms of a Cape-wide emergency operations center or just getting the word out or.
So the Cape does have the Regional Emergency Planning Committee, which is led by Sean O'Brien, who's the Director of Barnstable County Health and Environment. And they were very active during and kind of in the background. They worked in concert with Senator Julian Sear from Truro, did a great job with the Cape Cod Reopening Task Force. So there was a partnership there, and I think that will continue. That has all the elements and all the stakeholders in it. So I see that moving forward. One of the other things I wanted to emphasize is, and a lot of you are in private sector business, Chamber of Commerce, basically having a seat at the table in the Emergency Operations Center is something that we've done here in town. And it's a conduit for information for our private sector partners. And one of the things I told Dr. Ward yesterday is we have this Beat COVID initiative, BE18. It stands for Business Employment Assistance Testing, where any business in the town of Sandwich that has a symptomatic employee or somebody that's an exposed person can be tested free of charge rapidly here at the fire department. And that is to keep the community moving forward, driving the economic recovery, which was a huge hit for the municipalities here in Massachusetts. And it's initiatives like that, having the chamber, having a seat at the table in the Emergency Operations Center, having a seat at the Regional Emergency Planning Committee. I think that's going to improve things moving forward, regardless of what the disaster is. You need that private sector involvement with emergency operations to make sure the information gets to all the stakeholders that are in the community.
Well, Chief, thank you. This has been, and Chief and Jane, this has been a very stimulating conversation and very positive. Gives us a lot of hopes that there will be some lessons learned from this pandemic to build a healthier Cape for the future. So I want to thank you both very much. We're coming up on 11 o'clock, so I'm going to send it back to Bert. But before we do that, just wanted to ask Chief if there's anything else that you'd like everyone to know about your topic.
Nope, I would happy to come back in 6 months when we're in the middle of fall, winter to see how things are going.
Oh, that would be great. We'd love to have you. Thanks again.